Welcome to the Confidence Through Health podcast. My name is Jerry Snyder. As a health, wellness, and sports performance coach, my goal each week is to bring you experts to help you take control of your health and build your self-confidence. Thanks for including me today on your journey to better health. As an elite level runner and coach, I'm excited to introduce you to the All In Running Club. The All In Running Club exists to help you become a better runner. Whether you're a beginner, an elite runner, or anywhere in between, the mission of the All In Running Club is to give you the tools you need to find your success in running. Join today to take advantage of the 75% off yearly membership rate offer. Click the link below in the show notes to learn more. Well, thank you so much, Dr. Lindemann, for being a guest on the Confidence Through Health podcast.
Thank you so much for inviting me. I really appreciate it.
So this is a slightly different topic than I usually have on, but it's an important topic. And when you look at health overall, like it all starts in the womb. And so it's important to look at it and say, okay, well, how can we make sure that women are having healthy pregnancies? You know, and one of the things that you strive for is that helping women have healthy pregnancies so that they can have healthy deliveries and healthy babies and whatnot. So tell us a little bit about like why that's a passion for you.
Well, I've always enjoyed being with people, and forming a partnership, I think, is just extremely important. That is a good relationship that's based on trust and the ability to ask questions and to get answers, and to take the time that you need to take it. And, you know, the thing that I fell in love with, as far as obstetrics goes, is it is the only place in medicine where you get to start out with a blank slate. In other words, you're not fixing a heart attack. You're not fixing diabetes. You're not fixing cancer. You have 80, 90, or 100 years of potential that you can participate in.
Right.
Not that I can give 100 years, but at least I can participate in that. So that was the fun thing for me, the potential. And you can steer people in the right direction. And that was also really fun.
Yeah. And when you think about it that way, it's true. It's that you're helping women and men as couples, but women have to have a majority like stake in the matter when it comes to creating the health for their baby. And like you're helping guide them to set the foundation for what could be, years of healthy living for that child.
Well, you're absolutely right. It's nice to get off on the ground floor. And you were talking about dads. I've always welcomed dads to the prenatal course. As a matter of fact, I really have recommended that because you get to see how people work together. You get to see the relationship. I've also welcomed the children. So, one of the problems with children sometimes, say, for example, you have 4 children and you're on your 5th.
Right.
It's the 4th child that's going to be displaced. And that's the one you have to be concerned about. You have classes on how to introduce your dog to your dog or your dog to your child. There are no classes to introduce the 4th child to the 5th child.
Right.
So those are some of the things that I got to do. And I know how important it is for dads and moms to support each other when they're raising their children, and especially during pregnancy. So it's a wonderful opportunity, a prenatal course, and actually the postpartum course for a year. Wonderful opportunity to help people get ready for the next, like I said, 60, 80, 100 years of their lives.
Right.
So opportunity it's really fun. Yeah.
And I would imagine that you've been doing this for a while, and granted, people have babies, they move, and the kids move off. But in instances where you've had, okay, well, I delivered this baby and now this child is having a baby, like to get to see how when mom becomes grandma and they pass down the things that they learned because they went through it in a proper, healthy way, like that's a huge part of like just creating that healthy environment, right?
It is very important. And, I have a little story I can tell you. Years ago, I had a patient come in with quads. She had in vitro, she was an infertility patient, 4 babies. And So she had seen 3 doctors before me. And of course, I always advise people to if you're uncomfortable with the first doctor, don't stay there, move
Right.
on. You can interview your doctor like you and your wife did.
Right.
Anyway, she came in with her husband. We had a long talk, probably an hour, and the big problem was that they had been advised to reduce the amount of babies. In other words, they had been told that they should make this twins instead of 4.
Right.
And that was an offensive idea to them, and one that they could not justify because, like mom and dad said, they're all going to get the same chance. They're all going to live or they're all going to not live, but they're going to get the same chance. So anyway, now that was that was in 1980 or 1998, so 25 years ago.
Yeah.
And we have a video of that. It's free. So if you want to watch it, just on YouTube. So we got the 4 quads all grown up, and mom and dad and me talking about the first visit and what it was like to go through pregnancy and also postpartum. Dad said he changed 7,000 diapers a month.
Oh my gosh.
That's commitment. And
that is, man, that's crazy.
And dad doing it.
Yeah. Yeah. Oh my gosh. No, my wife she'll tell you that she enjoyed the times when I would have, baby duty in the middle of the night, because she was like, and she loved the fact that I wasn't scared of changing diapers. And now I know I didn't do that many. I couldn't imagine that. Maybe that would have scared me off, but that's quite the load.
You do what you have to do, and it's really amazing. I mean, because I know I have 3 children, and I know what it's like to have sick children, the earaches and the fevers all night. I can remember one night, it was with my youngest son, and I was busy being a doctor and up all day and up all night. But I spent most of the night on the floor with him under the dining room table. I don't know how it was that we wound up there.
Yeah.
But it was a place where we could both sleep for a little bit. So,
oh my gosh, that's so funny. So when we look at women and health, like, what are some things that women can do to improve the health of their pregnancy?
There's a lot of opportunity, like I said, in pregnancy, and that's the fun part of prenatal care and postpartum care. But one of the important things is to watch blood pressure. If you look at NPR has a lot of sad stories, like, for example, Tori Bowie. You're probably familiar with her, the fastest woman in the earth.
Right.
Well, she died.
Yep.
She died in pregnancy. She was about 35, 36 weeks. So, it was a time when the baby could have lived.
Right.
If you look at it, it was really hard to find any decent information on her. But I think there was a lot of opportunity there, because if you look at the size of the baby, it was just over 1 pound, and that would be like 26 weeks. So what I'm saying is there were 10 weeks where her blood pressure would have been elevated and somebody could have done something.
Right.
Now, for blood pressure, and there's actually recently articles on this, and I'm surprised after 50 years of recognizing that one high blood pressure is the problem. It's the herald sign. It indicates the future. And that's one of the things you can do with pregnancy, is look for hints of the future. So, years ago, before I got smart, or smarter anyway, I used to send the patients to the hospital, and the nurses would check their blood pressure 20 times until they found the lowest pressure and record that. Then I'd see the patient back a week later, and the blood pressure was even higher.
Right.
I just stopped sending the patients in because I knew I was not going to get the information I needed to get. But I started treating those patients at home. And a lot of times it's really just simple. Say, for example, you have somebody who she works 12 hours a day, 3 days a week. That's bad for pregnancy. So sometimes they have to work, 6 hours a day, 5 days a week, not quite as many hours, but it's enough of a change to make those blood pressures go down.
Right.
Sometimes they have to stop working altogether. Sometimes stress, work is stressful physically and emotionally.
Right.
So, in my experience, I've had and that's about 6,000 births. I've had no moms even have a seizure. That's, if your blood pressure gets high enough, you can have a seizure.
Right.
That's called eclampsia.
Mm-hmm.
You change from pre-eclampsia to eclampsia. I've never had a patient seize. If you look at the literature, it's not difficult to find examples of patients who have seized either before or after. The seizure is not the problem. The problem is high blood pressure,
Mm-hmm.
and that can kill or
Right.
leave a woman permanently injured. So we have this herald sign you can watch, and you can get moms invested in the treatment, and you can avoid all of that. So that's one way. It's actually a kind of a fun way, and it also goes back to my original statement about partnership.
You're right.
And another way that really helps moms is talking with them about how to eat, because pregnancy is a time of, in the beginning, it's a time of low blood sugar. When their blood sugar goes down, they lose their appetite and they feel sick. They feel nauseated. So it's really a matter of avoiding nausea. And you do that by eating a balanced diet. For example, a bad breakfast is the kind of usual breakfast most people have that includes cold cereal, skim milk, orange juice, and a piece of toast.
Right.
That's the wrong breakfast.
Yeah.
But if you really want that breakfast, add an egg to it.
Right.
Or a piece of bacon or a piece of cheese, or, substitute an apple for your orange juice.
Right.
A little butter on your toast. That becomes a breakfast that sustains blood pressure so that you don't feel rotten for the rest of the day.
Yeah.
There's lots of things that moms can do, but they have to know they can do it.
Right.
So they need permission and they need education.
Yeah. And is that something that, like, when you say they need permission, because I can imagine, obviously I'm a guy, so I'm never going to actually have that feeling, but putting myself in their position, if somebody who's not educated in a health way, in pregnant, going like, I could really mess this up if I do something wrong. Right? Like, is that fear there?
I think it is for some people, and I think it is in some degree. Yes. And I haven't met a pregnant woman who isn't interested in the benefit to her baby.
Right.
There's something that takes over, no matter whether the pregnancy is planned or not, that there's this built-in protection. And of course, you see it throughout all of nature, and you've seen it for probably 200,000 years or more.
Right.
If you go into the chicken coop, the mother hen is there, and the mother cow is very dangerous. You don't want to get near a calf.
Right.
But the instinct to parent is strong.
Yeah. So having that information is important in like you said, in that partnership. And so picking the right doctor, it can provide you the right information. And so and I love the blood pressure deal, because that's something that nowadays you can get that reading like pretty much for free anywhere you want. Like, you can go anywhere and get your blood pressure taken.
I have always recommended for my patients to buy a blood pressure cuff.
Yeah.
And to check their own blood pressure and to call me if it's over, a certain point. Blood pressure is relative. So what's good for one isn't good for another. I mean, sometimes some women start out with 100/60. Some women start out with 140/90.
Right.
And if I do have a blood pressure story I can tell you. There's a lady who came in. She was about 145/90. And I thought, what am I going to do with you? How can we get through this?
Right.
Well, I gave her just a little bit of it was the medication that was in style in those days. It was Aldomet. We got her pressure down a little bit. And of course, as she progressed in her pregnancy, blood pressure came down. She actually delivered at term, and she delivered a 9-pound, 3-ounce baby boy vaginally.
Yeah.
So, it's not the absolute blood pressure. It's what is relevant or good for
Right.
that patient.
Right.
If, say, the lady with a blood pressure of 100/60, if she went up to 100/90, she'd be in trouble.
Yeah. And so it's more of a like, yeah, what's relative to you? What's your starting point and how is that changing? And then
Absolutely.
if it's changing too much and your doctor's not helping you figure that out, maybe it's time to look for somebody else.
I think absolutely. And of course, one of the problems today is that we have HMOs and all kinds of managed care organizations that tell you where you can go.
Right.
And yes, one of the problems is, say, for example, there's 5 doctors in a group, and your insurance says, oh, well, you have to see one of them. Well, changing from number 1 to number 2 in that group probably isn't going to fix anything, because there'll be the poisoned well.
Right.
So your insurance company has a lot to do with it. And I think sometimes people just say, well, fine, I'll just wind up paying more for this and go out of network.
Right. Which, it's when we're talking about, like you said at the very beginning, the 80 or 90 or 100 years, like that's a very small investment to make in the health of a human being.
Well, you're absolutely right. And that's one of the fun things about obstetrics, because such a small thing can mean so much for mom and dad and the next 100 years of somebody's life.
Right. So let's talk about one of the things when my wife and I started going through infertility issues, I had no idea. I mean, of course, as a guy, you don't think about some of these things, throughout life like women do. But I had no idea how many women have miscarriages.
Yes.
It's pretty common, right?
Mm-hmm. Yeah.
Like,
we have now the more sensitive pregnancy tests. And if you look at them, there are many miscarriages that even happen before the first period. So if you look at that, the rate is about 40%. But if you look at, say, for example, the ones who survive after the first period, then you're looking at more like 15%. And if you're looking at the miscarriage rate, say, after you hear the heartbeat, then that's down to probably less than 5%. So, yeah, once you get to a certain point, things get a little more stable for you.
Right. So what would be like the most controllable risk factor that women can look at of like, okay, we're trying to get pregnant. We want to make sure that we have a healthy pregnancy and avoid that range of miscarriages early on. Like, what's the thing that they can control the most in there?
Well, there's several things I think that are important, and a lot of times we don't think about getting pregnant. I mean, it just happens.
Right.
But if you're thinking about being pregnant and you want to prepare for pregnancy, I would say visit your doctor, get a simple test like a CBC that will make sure you don't have anemia. Another test you could get would be a CMP, which is a comprehensive metabolic profile. That will make sure that you don't have liver disease or kidney disease. And you can talk about any inherited diseases. In our society, cystic fibrosis is very common, very diagnosable. It's what we call an autosomal recessive. That means that each parent has to give one chromosome to that in order to have an affected birth. But those things are all things you can learn before pregnancy. The other thing is there are vitamins, micronutrients, we call them now, I guess.
Right.
Certainly folate is extremely important because that low folate has been associated with what we call neurotube defects. And they go from the head, which means some have no brain, they don't run, and they run for politics. They're politicians.
Yeah.
And some of them have defects of the vertebral or the spinal cord. And some of them actually have a defect that's so low they don't even know they have problems. But yeah, folic acid is extremely important to have a good level. Could even get that level checked, get a B12 checked. So yeah, there are ways to get ready for pregnancy. Once you're ready for pregnancy, then if you're planning, look for the fertile time. And the fertile time is usually up to 5 days before ovulation. And that, women know because they have mucus, which is thin, stretchy, clear. So yeah, there's all kinds of ways to get ready for pregnancy.
Okay. And so if they're, once they get pregnant and they're, one of the things that I know that you're really working towards is having a healthy pregnancy all the way through. What are some warning signs that like they should be alert that like, okay, I need to go in a different direction because something's not right. My doctor's not helping me in this way, but like, what should they be feeling or seeing or thinking like, we know high blood pressure, but is there anything else that like would give them an alert that like, I need to take more control of what's going on?
Yes. If they have trouble eating, there are ways. I've never, in the 6,000 births, I haven't had a patient who has needed a nose hose or IV nutrition.
Right.
Because I talk with them about it. But sometimes you're not going to get that kind of attention. So if you find you're not losing weight or not gaining weight, and you find that you're having trouble eating the whole day long, and if you're finding that your doctor isn't listening to you, or you see a different person every time and all they do is chart, write in the chart and make sure that they do their 2 minutes worth of work and then get out of there. So yeah, if you're not gaining weight, the other thing is if you have a family history of early heart disease, say your mom died at age 40 from a heart attack, you are much more likely to have trouble with eclampsia. So that's a conversation that you need to have with your doctor, and you with your doctor need to make a plan. That's the partnership.
Right. And that's having a doctor that's open to going above and beyond just here's what I see from your body and your vital signs.
Exactly. There's a little bit of something called listening.
Right.
Years ago, somebody said, how do you ever learn anything? You talk all the time. So I try to listen more and talk less.
Right. Well, I just saw, and I can't remember who it was that had the quote, but like if you're talking all the time, there's no way you're going to get any new information because you can't hear it.
Yeah.
And it's so true. It's, and I think sometimes patients get into this habit of like, I go in, I tell my symptoms, they're supposed to tell me what I do, and I leave. And that may work in some situations, but when it comes to pregnancy, I think you need to go in with a different mindset.
Well, pregnancy is a wonderful opportunity for a doctor to get to know the patient. It's really one of the only times you see somebody, say maybe 8 or 9 or 10 times. And so you can develop a relationship. Now, if it turns out that you're in one of these groups where you see a different person every time, and sometimes it's a nurse practitioner who isn't going to be at your delivery, it's really hard for you as a patient to have a relationship. A lot of times they don't know who their doctor is.
Right.
But it's also hard for the provider to really understand who that patient is. And, one of the nice things about knowing your patient and having the partnership is there are many times I walked into a room, labor room, the patient is in labor, she's almost ready to deliver, and she's screaming and crying, and says, I can't do this.
Mm-hmm.
And so what they need to hear is, yes, you can do this. Yes, you've got about 10 minutes left. We'll get through this together.
Right.
So, you can't exercise that kind of influence if you don't have a relationship with that patient.
Right. Yeah, that's tough. So what in trying to build that relationship, what's the most important question in your mind that women should be asking their doctor? Maybe it's as they're exploring the idea of becoming pregnant and starting their family, or I just found out I'm pregnant, my first visit. Maybe it's a new doctor because they're in a new town or something. What's the most important question they should be asking that they're not?
I would say there's two questions, and this is one of the things we talk about in our book, and it has to do with partnering. Mm-hmm. But who am I going to see in the prenatal course? Will I see you, and will I see you every time? The other question is, who's going to be at my delivery? What are my choices? What are my chances of seeing you? We have something now that's called Doc on Deck. And this is one more example of a change that's been good for doctors and bad for patients, because you may wind up being in labor and delivering with a person you have never met. Right. And that is a much different experience than going through a delivery with somebody who you consider to be your partner.
Right. Because I'm thinking back to okay, well, I've had a couple of surgeries for different reasons, and one of the things I think of is okay, I want the best surgeon available, right? I don't have my lung collapsed, and I didn't have a relationship with a lung doctor. It was I just want the best person available that can do this. But that's a different scenario. And I would look at a pregnancy going, like you have said, I want somebody I trust that can help me through this process, because it's a different scenario if you're not trying to fix me.
Yeah, you're right. I mean, when you have a collapsed lung, that is really an emergency, and I'm assuming it was a spontaneous collapse.
Yep.
And those are actually, I have done a little bit of studies on those, but you're ready. I had gallbladder trouble and I was in so much pain. I thought, I don't care who you are.
Right.
Yep. And I had a doctor who was kind of a jerk, but at least he got my gallbladder out. So fine. But if you have a choice, and you are in prenatal, you are looking at seeing somebody for 6, 7, 8, 9 months or more, certainly you should choose. You should be able to choose. And a lot of times I think it's use your judgment. In other words, how does this feel? Does this feel good to you? Does this feel right? A lot of people stay out of trouble simply by asking, does this feel right to me? Is this right or wrong?
Yeah.
And most people will come up with that they know the difference.
Yeah. Yeah. Very true. And when it comes to, and I can imagine I've heard my wife say this, of course, when she's gone to get a checkup and it was somebody other than her normal doctor. And she's like, okay, that was a little different. That's somebody I don't know who's looking at areas that, nobody else really looks at. And I imagine that can be very uncomfortable for a lot of women.
I think it is. There's something that's really, I think, comforting about seeing the same person it used to be every year, when we recommended pap smears every year. Of course, now we're recommending them less often. And guess what? for some reason or other, it's a surprise that cervical cancer is on the rise.
Right. Right.
Well, we're not checking for it, just
Yeah.
like prostate cancer,
Yep.
Gee whiz, we stopped checking for it, and oh my, now we have this surge of prostate cancer.
Right.
So yeah, there's something to be said for regular examinations and taking things seriously.
Yeah. And it's not just for someone who's in that pregnancy stage of life, but even afterwards, like that care needs to continue on, because you have the changes of menopause or potential hysterectomy down the road, just because of the way that life in your body develops and changes and all of those things. And so having that continued care all the way through is extremely important, right?
It's really important. And, one of the fun things, I actually look forward to seeing people, for an annual exam, or, every other year, monthly exam, whatever it is, because you get to know how they work at home. You get to know, for example, I'll never forget the lady who sold RVs,
Mm-hmm.
So, we talk a little bit about the how's RV sale coming. And
Right.
so, yeah, I got to know her husband and what she was thinking and feeling, and what she was worried about and what she was happy about. So that's actually fun, the
Yeah.
fun part. Yeah.
Yeah. Well, and I can say from my wife's experience of having an OB-GYN that didn't really direct us in the right direction for what we needed at the time when we switched. And now I don't know how many people she's recommended to go see this doctor now, because she's just like, she loves, what he's been able to do for us as a family, and guide us in a direction for her care. And like, she can't say enough about him. And I think that's a testament to him, but it's also a testament to the relationship that he builds with, because she's not the only one that says that. She'll mention his name to somebody else, and they'll just start. It's a 20-minute testimony from them about how great he is.
Well, word of mouth is really your best. I mean, it's really a good source for the provider, but it's also a good source for the consumer. If you have 3 people who are satisfied or happy with this doctor, probably you're going to have the same experience. So
Right.
It's a very good way to pick somebody that you are going to be comfortable with.
Right. And so besides the obvious of smoking and drinking, like obviously we know those are bad for pregnancy. Are there any other things that like women, like lifestyle changes or habits that women need to look at to say, okay, well, I need to make this change to make sure that I give myself the best odds for a healthy pregnancy?
Well, of course, you're right. No smoking and very little or no alcohol.
Mm-hmm.
We just really don't know how much alcohol it takes to get a
Right.
fetal alcohol syndrome baby. So that's why the recommendation is no alcohol. Although there are women who do have a glass of red wine from time to time,
Sure.
and they have 8 normal babies.
Yeah.
So you don't know. It's probably going to be different for everybody. There are many things that you should be thinking about, I think, but certainly one of the things is exercise. Now, some women they run 3, 4, 5 miles a day, and the issue becomes, should I continue running?
Right.
And the answer is yes. If you're well established, if this is something that you do and have done for many years, go ahead. You might want to watch your pulse, try not to get it over 140, but exercise is okay. A little exercise is really good. Don't start new exercises for pregnancy unless it's something very simple like swimming or yoga or, meditation. Those are all things which would be safe to start if you wanted to.
Right. But yeah, and I remember, I can't remember exactly how long ago this was, but I'm a track athlete, and I remember hearing about one of the collegiate athletes that got pregnant and continued to train until she was like 7 months pregnant, and like training hard, like out at the track. And there were videos of her out at the track doing hard workouts. And, but it was thankfully put in a context of this is what she's done all her life. She's continuing. She's under, obviously care from the athletic training department and all of that. And so she was being watched very carefully, but, it was also under the amazement of like, okay, well, this is what's possible for women that are, it's not just, okay, I'm pregnant. Now I have to just sit down and I can't do anything because I'm pregnant. I have to be careful.
Well, you're absolutely right. In my experience, I have never seen any athlete have trouble with pregnancy in any way. Of course, we do. I'm going to go back to Tori Bowie again. Mm-hmm. You would know her well because of your track.
Yep.
One of the things that people don't understand about pregnancy is that preeclampsia has no limitations. That is, you can be the most physically fit person in the world and you can get preeclampsia. So good physical fitness does not protect. And preeclampsia is only pregnancy specific. In other words, if you're not pregnant, you'll never get it.
Right.
But nobody, and I think that was one of the problems that Tori had. She probably thought, I am so physically fit, nothing can go wrong.
Right.
And that is just not where it is at all. So you have to be aware of the fact that anybody can get preeclampsia.
Well, I think that just goes back to one of the things that I tell people is that, because I try to lead a very healthy life. And sometimes people ask me like, well, why do you go to the doctor? And I'm like, I go for a checkup and I get, my blood work done every, on occasion or, because I can only see what I can see on the outside. I have no idea what's actually going on inside. I'm giving myself all the proper things to hopefully get in the right direction. But is it working or not? Nobody knows unless they do a test to find out.
Well, there's a lot to be said for testing, but I can tell you by looking at you, you look healthy.
Yeah.
If you came to see me in the office, I'd say, this is a healthy looking guy.
Right. But it's the same thing with pregnancy, right? Like, because you really don't know what's going on until like you do an ultrasound to check things out, or you do something to make sure that like, okay, all the signs are in the correct direction.
Yes, certainly you can gain a lot of information by ultrasound testing. That of course, there are now people who say that that's not such a good thing, but I guess in the long run, probably the most, if we look at all the information, we probably should come down on the side of, yes, we can do ultrasounds, but we need to limit the amount of ultrasound exposure, and we shouldn't be doing this for fun. Right.
Yeah. And because you can get a lot of good information, like you've said, from talking to somebody. And like you said, if I came and sat down in your office and you asked me, okay, what's your diet? What's your exercise? What's your lifestyle like stress wise? Then you'd probably go, okay, we don't need to do this test or that test because it'd just be a waste of money or waste of exposure for whatever, it could potentially cause me harm as far as maybe x-rays or any of that kind of stuff. And so if there's that communication line there, then that can take a lot of the pressure off.
Yes. Yeah, exactly. A little bit of time. And of course, listening, all of those things are important. I'd say right now you've got about a 3% body fat. So
pretty close. Yep. So, and so speaking of that, like I know a lot of women and I've known a lot of women that have gotten pregnant just from, my community that have talked about like, okay, now I've gained too much weight, right? Like their doctor's telling them, oh, you've gained too much weight. You need to work on this. You're going to have this, that. Like, is there and this could again be just something that's just individualized, but is there okay, now you've gained too much, or because I know there's an issue of if you're not eating enough, you're not gaining enough, you're not creating that environment. But can we go overboard?
Well, yes, and we can and often do. And of course, you have to then ask, well, why is this? Why are you gaining weight? Are you preeclamptic? Is your blood pressure out of sight? On the other hand, are you eating too many milkshakes? And the thing about it is, you never ever recommend losing weight during pregnancy or maintaining weight. So if you gain too much weight, you can't tell somebody to lose that weight.
Right.
All you can do is say, well, try to gain less weight.
Right.
There are women who do gain more than 40 pounds in pregnancy, 60, 70, even 80 pounds. I wouldn't recommend that, but on the other hand, a lot of times those patients actually do all right.
Yeah.
But nobody should lose weight during pregnancy.
Right. So even if you've gained too much, if they're telling you to start losing weight, that's a big red sign.
You do not want to lose weight in pregnancy. Years ago, I worked with this lady. She had twins. And the doctor told her to smoke during pregnancy and to not lose and to not gain any weight.
Yeah.
So when she delivered the twins, she was automatically 60 pounds lighter. Of course, we don't recommend that anymore, but this is the way things used to be during pregnancy. Go ahead and smoke and don't gain any weight. And I guess she's kind of lucky she has twins,
right?
Living twins,
right?
Although I don't know what exactly might have been done to their intellectual ability during that time,
right? Because that is a big, obviously in the development of the baby, all the different exposures that the mom puts them through at the different timings. There's different risks, right? And some risks are higher at this point and this point and so knowing all of that stuff is it's something that, one, you want to do your research on, but two, you want to make sure you have somebody in your corner that's guiding you in the right direction.
Yep. You want your partner there, your partners, whether it's your husband or your children or your doctor, you need the group partnership.
Yep. So tell us about, I know you've got Pregnancy Your Way, the book that you've recently released out. And then Modern Medicine, which it's now that one's a little bit older, right?
Yes. My wife and I wrote that book 32 years ago.
Okay.
So
go ahead.
We were concerned about the rising costs. And so we have 5 chapters. One of them is big business. In other words, when one hospital pays, $100 million to buy another hospital, where does that money come from?
Oh, yeah.
Well, it comes from you.
Right.
It comes from the consumer, And then we were also, right now I'm doing an article on nursing shortage and the nursing ratio. One of the big things that I think it's House Bill 106, and that's probably been passed now, but there was a lady, a PhD nurse who works at the University of Pennsylvania, who was talking about ratios, that is, the amount of patients per nurse.
Mm-hmm.
Well, one of the things that happened, and one of the things we wrote about, we used to have something called team nursing, so that the nurses had their duties, they passed the pills, they made chart notes, but we had aides and orderlies to empty the bedpans, to check the lights, to bring the food, to take the trays away. Well, and for some reason or other, about 50 years ago, nursing hierarchy got themselves in a knot about primary care nursing. So guess what? The cost-effective people, the aides, the orderlies, the receptionists, were sent packing So now all of a sudden, nurses had to do everything. Well, guess what? You had an overnight manufactured nursing shortage.
Right.
And that continues today. There are people talking about going back to team nursing, which would make a lot of sense.
Right.
So, and that would be my recommendation. The other thing I'd recommend, and that's not in our book, has to do with the amount of locums. For example, there are a lot of nurses who, hospitals are losing their old nurses. Now, a hospital will have to pay $100 an hour for one nurse.
Right.
And $50 an hour goes to the company that employs the nurse, and $50 an hour goes to the nurse.
Right.
Well, that means that for one nurse for one day, that's $500. For three nurses, that's $1,500. So, that's a lot of money.
Right.
In a day, or $3,000. So anyway, there are nursing shortages. There are all kinds of bad solutions, but my recommendation would be less paperwork.
Right.
It's estimated now that as a provider, we spend 2/3 of our time on the electronic record, 1/3 seeing patients.
Oh my gosh.
Yeah, right. Now, how does that make sense?
Yeah.
And think what that does to the patient partnership.
Yeah.
It's like putting a bomb in it.
Mhm. Oh yeah.
Completely destroys it. Well, anyway, I wrote an article about, we have a physician shortage, which is worse than the nursing shortage. Well, if we had half as much paperwork, we'd have twice as much time.
True. Very true.
Very simple solution.
Yep. Yep. Very true. Oh,
so
my
anyway,
gosh.
That's what we talk about in that book.
Oh, and those are available on Amazon?
Yes. Mm-hmm. Yeah. Let's see. Our book, Pregnancy Your Way, and Choose a Safe and Happy Birth. If you look at it, it's Amazon, but you have to put Lindemann behind it, or you come up with 25 other pregnancy books.
Gotcha. And then as far as if somebody wanted to get connected with you to find out more about what you're doing, or if they have questions about, what's going on with their pregnancy or how to get the right doctor in their area and getting your advice on that, how would they connect?
Our best place is ruraldocallen.com.
Okay.
That would be, and that's our main site.
And you've got a YouTube channel as well, right?
Yep.
Okay. So people need to go check you out and watch your YouTube videos and get all your great information there. So
yes, we get, like I said, see the quads video for free.
Right. And then, so is there anything else as we wrap up? Is there anything else that maybe you would have for those mothers out there, a word of wisdom or advice?
Well, I'm just going to go back to how we started, and that is a partnership.
Yeah.
For a partnership. And the partnership should feel good. It should feel right. So you're going to have to go on your judgment there. We did spend a little bit of time in the book talking about how you choose that. We talked about that. For example, who am I going to see during my prenatal course? Who's going to be at my delivery?
Yeah. Good big questions. So thank you so much, Dr. Allen, for being a guest.
Thank you. I really appreciate it. This has been fun.
Good deal. Thanks for checking out the Confidence Through Health podcast. Please subscribe, post a review, share this episode with those you love who need a little extra help with their health journey. Visit allinhealthandwellness.com to learn more about the coaching programs that I provide. All episodes are produced by the Social Media Cowboys, your source for all online marketing needs. Go to socialmediacowboys.com for more information.